Assalamualaikum, I'm Dr. Jahangir Abbasi. Today I have a girl, she's Aisha and she is 12 years old and she presented with inability to walk properly for the last 15 days. She's an otherwise well girl, she has a normal IQ, she's maintaining good eye contact, she's responding to the commands, but when I asked her to walk, she walked like this. Please look at the gait. शाबाश, चल के दिखाओ. ठीक है कोई बात. चलो कोशिश करो. जी चलो आगे चलो आप चलते जाओ. ठीक. So you can see the element of ataxia in the gait. You can clearly see the element of ataxia. बेटा अब एक straight line में चल के दिखाओ. सीधी line में चल के दिखाओ. शाबाश. Now I have asked this girl to walk in a straight line and it's really difficult for her to walk in a straight line. You can see the element of ataxia in the gait. Shabash, shabash. I wanted to see the rest of the cerebellar signs. बेटा एक उंगली इस उंगली पे लगाओ फिर अपने नाक के साथ लगाओ. So you can see there is clear pass pointing. First of all she passes the finger and then she brings the finger back. So there is a clear element of pass pointing. बेटा अब ऐसे करके दिखाओ. So there is a clear cut dysdiadochokinesia if the camera can focus on the hands. दोबारा करके दिखाओ. करती जाओ, तेज करती जाओ. You can see there is a clear element of dysdiadochokinesia. First she starts doing like this. She lost her balance and she was no more able to do dysdiadochokinesia. Now, the speech is normal. बेटा पहला कलमा सुनाए ऊंची आवाज में. Sure. So the speech is normal. There is no slurring or scanning speech, and I have also looked for the nystagmus. There is no nystagmus. I have also looked for pendular knee jerk, but there was no pendular knee jerk. Now I am going to see the rebound phenomenon. बेटा ऐसी खड़ी हो जाए. So you can see the rebound phenomenon was present. She was about to hit her face. When I just left the hand, she was about to hit herself. So this is called rebound phenomena, and the rebound phenomena is also present in this girl. Now, I'm going to do heel shin test in this girl. बेटा यहाँ बैठ जाए. यहाँ बैठ जाओ. बेटा आप पहले गौर से मेरी बात सुनो. आपने अपनी जो ये हील है, ये हील यहाँ से नीचे प्रेस करते हुए लेके जानी है. इस हील को उठाना है, इस टांग को ऐसे नीचे की तरफ प्रेस करना है. ठीक है? ठीक है मेरा बेटा. चलिए करके दिखाएं. शाबाश. फिर करके दिखाएं. फिर करके दिखाएं. अब ये वाली हील इधर प्रेस करके दिखाएं आप. शाबाश. Okay. I will differentiate between cerebellar ataxia and sensory ataxia. आंखें बंद करें, दोनों बाजू खोल. अब थोड़ा सा चल के दिखाएं. चल के दिखाएं. ठीक है. अब चल के दिखाएं. आंखें बंद करके चल के दिखाएं. ठीक ठीक. ओके. वापस आ जाए. वापस आ जाए. So you have seen that whether the eyes have been closed or whether the eyes have been open, there was an element of ataxia. That means it's a cerebellar ataxia, because the cerebellar ataxia remains there whether the eyes have been closed or whether the eyes are being open. So in order to conclude this case, the positive findings of cerebellar examination She's a 12 years old girl. She has a normal IQ. She's maintaining good eye contact. She's responding to my command. There is history of inability to walk properly for the last 15 days. And on examination, she has ataxia. She was not able to walk in a straight line. She has past pointing. Yeah, the dysdiadochokinesia was present. The test was positive, and she was also not able to maintain the balance properly, and heel shin test was fine, and the nystagmus and the speech were also fine. So I have a differential diagnosis of number 1, cerebellar ataxia, number 2, ataxia telangiectasia, and number 3, pharetic ataxia. So I would like to do an MRI brain to see cerebellum, to rule out any SOL in the cerebellum or some other lesion in cerebellum. Then I would also look for the skin and the eyes for telangiectasias, as there are no telangiectasias in the eyes and the skin is also normal. And I will especially look for pes cavus in this child and hammer toes in this girl to rule out pharetic ataxia. After MRI brain, if cerebellar ataxia is confirmed, then I will treat cerebellar ataxia depending upon its cause. And if I could not find out cerebellar ataxia, then I will look for the other causes of ataxia. So currently, just on the basis of history and examination, my provisional diagnosis is cerebellar ataxia. Thank you so much. Now, I have advised an MRI brain with contrast of this patient, and the MRI brain showed an SOL in the cerebellar region. Let me show you the SOL. Here you can see the SOL arising from the cerebellum, slightly protruding into the medulla. So now it's a diagnosed case of cerebellar astrocytoma, and surgery has been advised to this patient. I will further update you on this case later on. Thank you so much.